Welcome back to the Human Tourist podcast with me, Max Harvey. Today I am very honoured to have a chat with a great MD, a brilliant doctor named Dr. Thomas Levy. Dr. Levy is a board-certified cardiologist and a bar-certified attorney. After practicing adult cardiology for 15 years, Dr. Levy became fascinated and inspired by the work of the late great pioneering biological dentist Dr. Hal Huggins, whom he met in 1993 in Colorado Springs, where he had been practicing adult cardiology since 1991. After meeting Dr. Huggins, Dr. Levy then began what he has described as his second medical education. Working with Dr. Huggins, Dr. Levy began to research the enormous toxicity associated with much dental work, as well as the pronounced ability of properly administered vitamin C to neutralize this toxicity. He has now written 13 books, with several addressing the wide-ranging properties of vitamin C in neutralizing all toxins and resolving most infections, as well as its vital role in the effective treatment of heart disease and cancer. Others of Dr. Levy's books address the important roles of dental toxicity and nutrition in disease and health. Inducted into the Automolecular Medicine Hall of Fame in 2016, Dr. Levy continues to research the impact of the automolecular application of vitamin C and antioxidants in general on chronic degenerative diseases. His ongoing research involves documenting that all diseases are different forms of degrees of focal scurvy arising from increased oxidative stress, especially intracellularly, and that they all benefit from protocols that optimize the antioxidant levels in the body. In particular, the cause and effect relationship between oral cavity infections and all heart attacks is now solidly established. Dr. Levy's latest book, The Only Cause of Disease: Healing by Reversing Pathology, provides compelling evidence for a single cause of all conditions of ill health. It demonstrates that sickness and health occur at the biomolecular level. A negative flow of electrons from biomolecules, as stolen by toxins or pathogens, produces oxidative stress, whereas the positive flow of electrons to these oxidized biomolecules restores them to a healthy state. The book is linked in the show notes below. I learned of Dr. Levy's bright light of a body of work while in the darkness of experiencing the whole body effects of a long undetected dental abscess formed from unchecked past dental work. I hope you enjoy and find this chat with the brilliant Dr. Thomas Levy super helpful. So, welcome, Dr. Levy, to the Human Tourist podcast. This is a great honor for me and a real light because I was kind of in the darkness personally with a personal health challenge recently, and I always seem to personally have an in-person kinesthetic experience of something before I sort of go in deep and start learning about it, and that's the catalyst, as it is for so many people, in all sorts of ways, and health is always a entry point for going deeper into understanding surrounding subjects to whatever the subject matter of the health challenge is. And so, for me personally, I had three big abscesses recently, and they were not identified by my previous dentist. So I just was going along thinking when the symptoms came along, I thought, okay, my body can deal with that. It's pretty rough, but and I got over it. But abscesses don't go away. Yeah. I mean, I wasn't told that, and I had to kind of really, I thought I knew a fair amount about health and about oral health, but I really didn't. And so I knew of Hal Huggins. Um, but now, through this experience, I started going deeper into root canals, oral infection, how it affects the whole body. And it came about that I had whatever was in these abscesses in my jaw was going throughout my blood, my circulation, and kind of taking up shop around my heart. It's kind of setting up. There's a infection that's still clearing from around my heart. I think that's endocarditis is what that's officially called. And I didn't have
type of it where you have no choice but to be in an ICU. I was able to sort of manage it just about, and with the help of a friend who is a naturopath. But anyway, I first of all, Hal Huggins was an orthomolecular doctor. Is that right? He was and or
He's a biological dentist.
biological dentist, right? Okay. And he was a trailblazer. He was the man that, yeah, and a a unique kind of artist, like a life. To me, if I look at him and I hear him talk online, it's like listening to someone who's he's marching to the beat of his own drum, and and there's a lot of other people who do the same thing that magnetize to him. And that's what I'm picking up from you. Started learning about your work. I was like, this is you are shining light in areas that need light shined on it, and but with detail and with science. You're doing it with experience and scientific validation. You're doing it with, and you're explaining it all so well. So first of all, I'd like to ask you, what is orthomolecular medicine?
Orthomolecular medicine. Orthomolecular is a term that Linus Pauling initiated, some 30, 40 years ago. Uh, and it breaks down into two components. Ortho means correct, and molecular means molecule. So the whole concept is the correct molecule is the approach to proper medicine. So in your diagnosis, whatever that diagnosis must be, across the board, you have present certain toxins that are causing oxidation, the biomolecules are oxidized, and your treatment is not just to give something that reduces a symptom, but you use the orthomolecular, you use the correct molecule, often vitamin C, vitamin D, vitamin K, magnesium, and others, that not just relieves the symptoms, but stops the evolution of and actually reverses the pathology. It will then take biomolecules that have been oxidized and no longer function and bring them back to normal function. Because that's a very important concept. I'm trying to get out, been getting out for about a couple of years now in my latest book, is that all disease is not caused by, but is excess oxidation. And all excess oxidation is caused by excess toxins. And it may sound like an oversimplification, but it's not. That is the essence of all disease and all medical conditions. Any condition has a unique array of biomolecules, proteins, enzymes, etc., that when they lose their electrons, they're oxidized, they no longer work. So they become inactive players. And matter of fact, they get in the way of things working because they keep the other normal biomolecules from properly interacting with each other in their metabolic pathways. And we know this is true because when you can stop the new toxins, and there's lots of reasons for that, from coming in and oxidizing new biomolecules, and you can bring in tremendous amounts of vitamin C, nutrients, and reduce or take away the oxidation, give electrons back to those molecules, even supposed chronic diseases disappear. So it is the nature of disease to have excess oxidation. And if you can stop the new oxidation and repair the old oxidation, you actually resolve disease.
Yeah, absolutely. And understanding it in simplifying it in that way, it's access makes it so much more accessible for everyone to understand the general process of how our bodies are going through these constant cycles of kind of repair and renewal, and the challenge that the body. I mean, our bodies are miracles, obviously. They're complete, miracles that what they can do when they have the right tools, and is miraculous, I feel. And so in terms of regeneration, and you talk about vitamin C a lot as the sort of master antioxidant, or yeah. And Dr. Linus Pauling, of course, kind of brought an awareness, a great awareness of that molecule to the world, but still it's as if it was, I mean, everyone knows about vitamin C, but they don't know it still needs, it still needs more light shone on why and how.
This is an important concept, and I talk about that all the time, is ask anybody, ask any doctor, ask anybody. Oh, is vitamin C good for you? Yeah, you need vitamin C. And sure, who doesn't need vitamin C? But there's almost zero realization that it's more than just a need. It's a requirement. And it's the single most important molecule that you need to have in your body in proper amounts to have the electron flow and the health go throughout the body. So the thing is everybody knows you need vitamin C. The doctors know you need vitamin C, but they don't realize, and this is what I try to bring across, that it's the most important therapeutic agent you can have. Not just and the doses are astronomical beyond what you find in food or what you find in minimal supplementation. And that's because we should be making vitamin C and we lost the ability. So it's not something unnatural to have 15 grams of vitamin C in your body. That's what our bodies had years ago when our liver made its own vitamin C and we were a lot healthier. So the thing is yes, everybody knows vitamin C is good, but so few people and so few medical doctors realize it's the most important thing in their therapeutic armamentarium.
Vitamin C, and that the main reason being that it mops up free radicals. Is that right?
Yes. Vitamin C as an antioxidant has a full contingent of electrons, and it is also a molecule that has access everywhere in the body. That's important too. You can have molecules that do lots of wonderful things, but if they're fat soluble or they have a certain configuration, they don't get to other areas. Vitamin C gets everywhere. And when it gets there, it can donate electrons back to oxidized biomolecules. It can take oxidized enzymes that weren't working and bring them back to normal function. And I think anybody can see how quickly that can make a difference in your health if you have inactivated enzymes suddenly become activated.
Yeah, enzymes are something that it's a beautiful science in itself, almost. I think the whole enzymatic pathway element of our bodies, which is, I mean, I don't know much about it, but I do take systemic enzymes occasionally. I do take like serapeptase and that's a kind of it's kind of a reset. Your because when the enzyme I think if we take things like vitamin C or other antioxidants, that can do the same thing as almost because it's, as you say, it's working on enzyme pathways. They are. I mean, I'm still trying to grasp. You describe it very clearly. I haven't come across anyone who's described it so clearly. Molecule. Now, why is it that GPs don't give out vitamin C, and vitamin D, and these are, there's two or three substances like that, vitamin D, vitamin C. What else would there be? Magnesium, say.
Absolutely.
Those
Well,
three. Yeah.
the thing is it's well, the simple answer is ignorance. All right, they don't know. But the nasty part comes in is why don't they know? And they don't know because they refuse to investigate. They refuse to acknowledge. It's almost like they say in legal terms, almost like plausible deniability. As long as I don't know about it, as long as I'm not presented with something that's just going to slam dunk it in my face, and I'm going to say, oh my God, I'm doing the wrong thing. I should be doing this. Then it's never going to happen. But that has changed a lot. The pandemic changed a lot. I mean, we saw a lot of pure evil physicians, doing the wrong thing for money, promoting things that were bad, suppressing things that were good, many things, including vitamin C, but other things like ivermectin and all. Clearly, the agenda of the physicians, and of course the hospitals and pharmaceuticals, was not the best health and the best concerns of the patient population. And I don't know how much, but I think that opened up a lot of people's eyes that they just can't throw their warm body to their doctor and say, here it is, do with me what you will. I trust you to do the best thing. Like we talked earlier before we started this about AI and the information that's available now, physicians and people and anybody can get information in the blink of an eye. And as we discussed, it's not incorrect information. It gives you all the information there is, and you can have it argue against itself. You can say, okay, if I think this and you tell me this, what's wrong with my reasoning? I mean, you can go into all sort of nuances. Point being, though, is we have a body of information now, and nobody, unless they're just lazy, mentally lazy, and purely unmotivated, that should ever go to any physician or healthcare practitioner without a significant amount of information already on whatever their symptom is and what they're concerned about and what they're looking for.
Yes. Yeah, and it sort of raises the game for everyone, which is, it up levels everything when the patient can, do some good research themselves and present it to, and that can, I mean, I've done that myself in with GPs, and it's been a beneficial experience for all. I think it's helped. It's brought about interesting t conversations on health and how to solve whatever issue.
If if
Yeah.
you have a modern cell phone and a good Wi-Fi signal and any of the other different AI apps, including just straightforward Google, you have access, and this is no exaggeration, to every piece of information that exists. Just depending on how you ask the question and how you process it, it's all there. Just out of fun, I've asked my phone some of the most bizarre questions of the world, and it comes out with logical answers that fit. It's very, and then, like I said, I get it to argue against myself. I think, well, that doesn't sound right. And then I
Mhm.
say, well, what is the reason why what you just told me doesn't sound logical? And it'll give you another good answer.
Yeah.
And it does your research for you. It's great for me. Not that it makes my writing, but we have PubMed with all the literature sources. You can say, cite me the most significant articles in PubMed that support the information that you just gave me, and then cite me the articles that argue best against it. Oh, I mean, you have a day's worth of research done in 10 seconds.
Yeah, that's amazing. But I think it takes a
But
good
anybody
mind.
can use it. It doesn't have to be somebody like me. Anybody can just say, I've been having this symptom for this amount of time and this problems. What should I do? What should I evaluate? And they'll get very good answers now. It's not the internet of 5 years ago. This is
No.
totally different.
Yeah, yeah, I agree. But I th still think it takes a good for what you need a good mind to be able to discern what's coming back to you in terms of
Sure.
you need a sharp mind, and nothing can replace that, the organic human mind, and I think that's where there can be this fascinating meeting of the two, of the organic and the inorganic, and there's potential, yeah, for amazing, but yeah,
And
like
I mean, the sweep is wide. The sweep of AI is wide because I've written articles, not articles that were published in journals, but just articles that were published uh, my website and other places, and it goes through all of that. So I see some of my own stuff being cited back to me as an answer to my question. Point being is the breadth of coverage. It samples. It literally digests everything.
yeah, yeah,
Literally available.
it's like the left brain on like steroids, but I don't know about if, how good the right brain side of it is, but we'll see. Anyway, so another question I have is about you described the mechanics of how oral infection. You described this so well in your IOAMT talk I've recently watched, and it was the mechanics of how oral infection affects basically has quite an easy pathway to the heart, even though it has to go throughout the circulation of the whole body to get there. Uh,
Sure.
um, and could you describe that with that?
Sure. Let me start by saying I had mentioned earlier about all disease being increased oxidation of biomolecules in different arrangements, and that all of that oxidation is caused by toxins because that's how toxins damage molecules by oxidizing them. This then begs the question is, where do the toxins come from? And they come from many sources, but the biggest source of toxins that causes the most problems with the most people on the planet comes from infections. Okay, the oxidized byproducts of the infections, the endotoxins, the exotoxins, they contain large amounts of iron that are pro-oxidants. So really the way any infection damage is used because it's a huge source of new and ongoing toxins. Now, having said that, where do most of the infections that cause this problem occur? In the mouth. Okay, so it's oral cavity infections that contain and sustain most of the most significant infections that result in the chronic release of toxins into your bloodstream. Now, with regard to your answer to your question about heart disease, that's very interesting because let me start by saying there's a study done in 2006 where they did angiograms on people already that they knew had heart blockages, coronary artery disease. So these were already heart patients and they were doing angiograms. They did an additional thing on the angiogram is they put a catheter, a special catheter in that was like a little roto-rooter. It actually scraped the plaque out.
Wow.
And then they analyzed the plaque microbiologically. And in, I think it was 36 patients, all with a known coronary disease, all these plaques contained over 50 different bacteria, viruses, fungi, and other pathogens, many of them typical for the flora of the mouth, all right? And in patients without coronary disease, there wasn't this. So this really leads you to the conclusion that if it's not 100%, it's damn near close to 100% of all coronary disease is caused by a colonization of pathogens in the arterial wall of the coronary artery. What does this do? This provides ongoing infectious toxic stress. And what does that do? That consumes the vitamin C inside the blood vessel, makes it weak, and then the only thing left for the blood vessel to do is to compensate by making plaque to make the artery wall thicker and less likely to rupture. Because one among the many functions of vitamin C is you absolutely need vitamin C for structural integrity. When you stop bringing new vitamin C into the wall, the collagen breaks down, the connective tissue breaks down, and what once became a really solid structure becomes very weak and prone to dilation, prone to aneurysm formation. So that's what causes coronary disease. And so where does it come from? Well, I gave you the hint already that many of the pathogens are typical for the mouth. So what happens then when you have a root canal? 100% of root canals are infected and have little abscesses, and other teeth that basically the structure of the tooth breaks down, pathogens get into the pulp, and you have a asymptomatic silent abscess called chronic apical periodontitis. Point being is many people, even those who have not had root canals, have one or more chronically abscessed teeth in their mouth that they don't know is there because it doesn't hurt. But, and here you go, if you have a tooth and then you have an abscess sitting at the bottom of the tooth with tracking into the nerve, tracking into the blood supply, tracking into the lymphatics, and then you chew on it. Well, when you chew between two molars, you generate some of the highest pressures, if not the highest pressure of anything in any biological system is the pressure between two molars grinding against each other. And what do? They literally push into two things. They push into the lymphatic circulation, pathogens and toxins, and they push into the venous drainage, pathogens and toxins. Now, in the case of the heart disease, the lymph goes down here, neck and threat, and into the breast. That's the primary reason for breast cancer. But the rest of it goes into the venous circulation. Now, what's characteristic of the venous circulation? A very low pressure. So venous pressure is very low, arterial pressure is high. So the pathogens and the toxins get into the venous circulation, and they're not being accelerated anywhere. They're just floating through the venous circulation, and they go finally reach the lungs, go into the pulmonary circulation, come around until the pulmonary circulation, still low pressure, drains into the left atrium of the heart, which is still low pressure. And then the left atrium drains into the left ventricle, which is the powerful contraction chamber. And with one contraction of the heart, everything that was just sitting around low pressure venous system suddenly goes into from like 10 millimeters of mercury to 130 millimeters of mercury. And the primary receptor of every contraction of the heart is the coronary circulation. So all the pathogens and toxins come in, don't do anything until they get into the left ventricle. Then the left ventricle shoves them out with force and literally causes a mechanical, if you will, facilitation of being introduced into the endocardium of the blood vessels. And then they eventually get seeded, they start growing, and then you have the whole process. So coronary artery disease is due to the vitamin C depletion from a chronic pathogen colonization being seeded by the infections in your mouth.
Wow. Yeah, it makes so much sense. And I would say I've definitely had the experience of that. And it was not easy to communicate, or it was not easy to get the medical profession to.
And anybody who's looking through this too, let me repeat this too, because we all think about infections, take an antibiotic, that's fine. No, an infected teeth can never be brought back to a normal state. Okay. Once a tooth is infected, it's infected and stays infected for your lifetime or until you extract the tooth. So obviously the only real solution, maybe some future Star Trek time in the future, they'll be able to regenerate new teeth. We can't do it now. So once a tooth you have becomes infected and the pulp contains a lot of pathogens and pus and destroys all the connective tissue and all the circulation inside, that tooth stays infected forever and will cause you problems for your entire life until you get it properly extracted. I say properly because you need a biological dentist to clean out the socket and not leave a bunch of infection in the socket as well. So anybody that's listening, no. Shooting a laser down there, no. Taking a ton of antibiotics, no. None of that is going to resolve an infected abscess tooth.
Absolutely. Yes. I would say, I mean, I can vouch for that. I had two large molars taken out because of abscesses that were on the tips of the roots. And I was chewing on them, and what you mentioned about the forces, that pulsing this bag of bacteria and all sorts of nasties that you don't want anywhere, you just don't want in your body. It's just the constant sort of just a pump, basically pumping them around. And so
basically the abscess releases into your circulation. If you have an abscess on your hand and you pop it, it releases and you clean it up. There's nowhere for an abscess to go if you can somehow mobilize it other than into your circulation.
Yeah, I mean, yeah, it's true, and it's dangerous to lance an abscess oneself. I actually,
Sure.
yeah, I tried it, and I think I got away with it, but it shouldn't be done. But um, yeah, thank you so much for describing that, because it's a universal thing. So many people are having the experience of in a spectrum of severity of exactly what you described, and sort of the huge thing is our overall health that's affected, and the sort of diminishing of our life force and our ability to meet the demands of daily life because our energy is being diverted into looking after, containing an infection that we're not aware of.
Energy is electrons and electron flow and electron distribution. And if you take that away, not only you get the disease, but as you just put it very nicely, electrons are your life force. If you deplete the electrons, you deplete the life force. And the more you deplete it, the weaker and sicker you get until death occurs when there's no electron flow. So yes, that's what Dr. Albert St. Georgi, the discoverer of vitamin C, described back in 1937, was the fact that life is electron flow. Okay. And what takes electron flow away, toxins, makes you sick. And what brings electrons back into cells and makes you well are vitamin C and other nutrients and other electron-rich antioxidants. That's simple.
How about grounding? Does earthing have, feet on the earth and hands around on a tree, for example? Would that also bring in a lot of free electrons to,
Yes,
yeah.
yes. Actually, grounding is another source of There aren't many sources of electrons. Mostly, they're only going to come from a diet containing plant life. All right. You get electrons from eating meat, but only because the animal consumed plants. Because the electrons ultimately started from the sun, photosynthesis into the plants, and you either eat the plant directly or you eat the animal that ate the plant. The most efficient, and I'm not espousing vegetarianism, you do need some meat in your diet, but you're going to get the most electrons from a fresh source of vegetables and fruits and that sort of thing. Now, in the case of grounding, yes, that's another way to get electrons into the body. My only beef, if you will, with grounding is everybody that finds something that works or that they like, well, for lack of a better word, they become a bit too indoctrinated and almost a fanatic. So you have people just wanting to treat their cancer just with grounding. Well, getting more electrons is going to help your cancer, but there's a lot of other things that's going to make the process a whole lot better. And you shouldn't be so dedicated to the idea that grounding cures everything as to deprive yourself of other things that are very sound and very, very solid. Magnetic forces, properly manipulated, bring electrons in. I mean, when you have a magnetic flow in this direction, you have an electron flow perpendicular to it. So we do see a lot of things with pulsed electron PEMF devices, pulsed electromagnetic frequency devices that have good clinical results, and it's because they bring electrons into the body mechanically, without ingestion. So yes, those are the only three sources I don't know of, though, is from the proper diet, from grounding, and from properly applied electromagnetic forces. And low-grade electricity. You hear about healing from DC, direct current. Direct current is electron flow. So when you can apply electrons across an infected wound, all right, you will accelerate the healing of that wound by supplying it electrons, yes.
Fantastic. And I love how this simplifies it, to life force basically, and electrons, and electron donors, what can we take into our bodies that will help the process?
Life is a battle of the electron donors against the electron robbers.
Yeah, yeah. We do like to make things complex, humans, and we kind of forget sometimes to, go back to the essence of things, to, simplify and go back to the roots. What were we actually doing? What were we trying to find the answers to in the first place? And I mean, it just does make me think of how the medical industry is, $1 billion industry, for want of a different word, and um, many of the chronic diseases, lifestyle habits, and understanding fundamentals, like you say, about electrons, electron donors, oral health, um, if so education is the primary way to help. I think in and people are getting so much better at researching on the internet. So we're living in a potential potential golden age. But with AI, I mean, there's so much more to navigate now. You just wonder if it's like it's like every time we get close to a kind of potential golden age, something sweeps in to sort of the darkness sweeps in to sort of try and quell the light a bit, and it's a battle of either light and dark or electron donors and electrons, thieves. So, yeah. But anyway, thank you for answering those questions. Are actually my main questions. And so what may I ask what you're doing now with your work? You're working on a book at the moment?
No, I've just finished my latest book. It's called The Only Cause of Disease, uh, Restoring Health by Reversing Pathology, which is basically what we've talked about here.
Yeah.
And that contains all of the stuff I've been working with for some time. There's I'm trying to get the word out, and it's another toxin on the toxicity of iron being added to foods. I mean, we've been poisoned for 85 years. Most people, a majority of people have excess of iron in their bodies already. And here, every time they take a fortified or fortified food, they're taking in more iron. And I've even managed to, at least for the moment, get the attention of some people in Washington. So I don't know if something's going to happen. I'm hopeful that the MAHA movement with Robert Kennedy, I know he's seen this information and he seems to be impressed with it. So we'll see what happens there. But the thing is iron is so toxic. Okay. Now, is iron necessary for health? Yes. It's what I call a toxic nutrient. You need it in very certain minimal amounts, only to the point that you can synthesize a normal amount of blood. If you have a normal blood count, a normal hemoglobin, and you're taking in iron, all that iron is going straight to toxicity. The thing is very clear cut. The more iron you have in your body, the sooner you die, all-cause mortality. Iron is so toxic, it should be a prescription item. It should not be available as supplementation, because we've been, you may or may not remember this, but you remember Popeye the Sailor Man.
Yeah.
He started in the 1930s. They started the iron adding in the 1940s. And what was the Popeye message was eat a lot of spinach, which has a lot of iron and get super strength. Point being is the public has been systematically brainwashed into thinking that iron is nothing but good. I actually got, when some of this information came out about my interaction with Secretary Kennedy on this, I mean, the internet is such a swamp, okay? I mean, people that know nothing have no problem at all liberating tremendously ignorant opinions. And I mean, you're trying to get rid of iron out of our foods, you're trying to hurt our health, you're an idiot, and blah, blah, blah. It's sort of like dealing with rabid animals. If you don't take care of them, they're going to die, but you may get bit while you're trying to help them. Okay, so there's nothing. The most passionate people about anything are the ones that have the least information. The greatest ignorance spawns the greatest passion most of the time, unfortunately.
Yes, yeah. Emotions, the emotional body of humanity is well, it's been
With the chat rooms now, anybody can talk to anybody about anything. So everybody that's been frustrated for so long, I have this opinion and nobody can hear it. Now everybody can hear everybody's opinion. So there's a few brilliant comments out there, but they're pretty much drowned out.
Yes, yeah, I agree. But the topic of iron is as it's so essential. I was the naturopath friend of mine who his name is he's not just a naturopath. His name is Truth Calkins. He's a excellent healer. He was He was a talker. He was a speaker at the Longevity Now conference, I think, regularly. Um, anyway, he told me about iron and the heart and how men, particularly, um, this is an issue for men as we age. That is not talked about enough in terms of there's not great awareness about this. It's usually men who have the experience of a problem with their heart that start learning about this. Um, and donating blood is a great way uh, to knock down one's iron levels, and obviously it's a fantastic thing to do because you're helping other people at the same time. Um, um, it's something to look into, I think, for everyone. I haven't done it yet, but
No, there's two other things too. I'm not saying they're the only thing. Two other main ways to deal with iron.
hmm,
And the thing is, and this is why there's so much problem is, and this is why you should never supplement iron, is because very, very, very little iron gets naturally excreted. Usually when you take in a nutrient, it comes in, does a job, and then most of it gets excreted. No, you take in iron, it stays there. All right. And just a little bit every day, accumulate, accumulate, accumulate. There's very few people you're going to see that have coronary artery disease and a heart attack that have normal iron levels, normal ferritin levels in their body. All right. The ferritin levels are always going to be elevated, indicating there's always going to be excess iron contributing strongly to the oxidative stress that's causing the problems that we already discussed about in the coronary arteries.
hmm,
Now, you mentioned the phlebotomy, taking the blood out. That's very good. It gets a lot of the iron out fairly well, but it's limited by the fact that you can't do it that often. It's either 3 times a year or 4 times a year. I'm not sure, every 3 or 4 months, I forget. And and if you got a high iron level, you don't want to, you want to get it out a little quicker than in a few years, okay? Because you have a ferritin of 400, it's going to take a while to get it down to 20, which is where you want to get it. So you have phlebotomy, and you have two other things. One is called IP6, inositol hexaphosphate. It's actually the medical name for phytic acid or phytate that exists in your food and naturally binds up iron and other components of your food. And when you take it on an empty stomach, it gets absorbed in the system and it goes in and it binds up and it chelates the iron in your body and you excrete it. So it's a very simple, very inexpensive. The thing to do though is you take it on an empty stomach. If you take it after you eat a whole lot of meal, it's just going to bind up to the stuff that's already in your food. But when you take it on an empty stomach, first thing in the morning, glass of water and 1,000 milligrams at your bedside capsules, take it while your stomach is empty. It's out into your system before you start doing your breakfast and all your other routine. And the third thing, if it can be afforded, and also if you have the time, because it can be a little time consuming, is a far infrared sauna.
hmm.
A far infrared sauna, if you make the investment, a couple $1,000s for a nice at-home unit, that's one of the best in health investments you can ever make, not just for the iron, but for all the other toxins it's going to bring out of your body. A lot of the literature says you can't sweat out toxin, which is absolutely wrong. Iron is very readily sweated out. They even have young athletes, men and women, competing in aerobic sports that will actually sometimes sweat themselves over the course of a season to the point where they have an iron deficiency anemia. In other words, they've sweated out so much iron out of their body that they didn't have enough iron to make a complete normal blood count. So no, iron you can get out very easily. The only thing for people to remember if they get a sauna is, well, you should be supplementing magnesium anyway. One of the most important things you can supplement, but you should be even more vigorous with your magnesium supplementation if you do a sauna on a regular basis, because in addition to all the toxins, you sweat out a lot of magnesium.
Fantastic. Thank you. That's so clear and helpful. Um, Actually, I was one thing I was wondering about balancing iron or helping it to be shuttled out of the body. How about copper? Uh,
Copper, you want to like the plague. There's
okay.
three basic nutrients: calcium, iron, and copper. You never want to supplement any of them. Copper is just sort of like an iron twin. All right. It does all the same things that iron does. It doesn't get out of the body. It stays steady state in the body. Very little gets excreted. And there's all this enormous enthusiasm out there, books being written and this, that,
Yeah.
and the other, jumping on the. Do not supplement copper. You're supplementing poison to your body, period. And just like iron, we have the all-cause mortality studies. Now, you have lots of studies that say, oh, when you do this, it affects this enzyme, and the test tube, it does this. If you do it under this circumstance, it does it. All that is good information. But if you have a quality, properly performed study that shows the more iron in my body, the more disease I have, and the sooner I die from any disease. The more copper I have in my body, the sooner I die, the more disease I have from any disease imaginable, called all-cause mortality. Your chance of dying from any disease is accelerated by copper, is accelerated by iron, period, end of story.
Wow. Because I was taking a BioCopper 1, which is sort of it's interesting. Okay. Oh, thank you. Thank you for that. That really helps. I'll have to go and donate blood, I think, to get started then.
It's good too. I mean, it's a good habit, and there's very few people that have a normal ferritin level. I mean, the ones that have normal ferritin levels are the kids, and the young to middle-aged women who menstruate on a regular basis, and so they're doing their own natural phlebotomy of getting rid of blood and losing iron in the process.
Right. Yeah. Yeah. Thomas, thank you so much, Dr. Thomas
Right.
Levy. You're a bright light. You're such a bright light. I really mean it, because in the world today, there is such just so many cross streams of information. As you say, there's AI. It's not easy to discern. We need people that have studied and had direct experience, you've learned alongside Hal Huggins, some greats, and you are, in my opinion and others' opinion, you are at that same level, and it's such an honor to speak to you. So,
All right.
thank you.
Okay.
Thank you.
All right. Thanks for having me. Have a good day.
Thank you, and you.
Bye-bye.
And you.